Have you ever taken your dog to the veterinarian for a routine visit only to hear something unexpected? Your dog has a heart murmur. For many owners, these words create immediate fear. You may start wondering, does my dog have heart disease? Is my dog going into heart failure? How serious is this? And I understand why those words can feel really scary. This is actually a topic that's very personal to me. Over the years, I've had multiple dogs of my own that I've diagnosed with heart murmurs, heart disease, and even heart failure. So I know firsthand what it feels like to hear those words and wonder what they mean for your pet. The truth is, a heart murmur can mean many different things. Some murmurs are mild and simply need monitoring. Others can be a sign of underlying heart disease that requires further evaluation and treatment. But the important thing to understand is this: a heart murmur is not the same thing as heart failure, and hearing a murmur doesn't automatically mean your dog's in danger. Today, we're going to talk about what a heart murmur actually is, how veterinarians grade murmurs, what causes them, how we determine whether they're important, and what treatment might be needed. I'm Dr. Matt Clark with Class and View Veterinary Clinic, and I'm here to help. This is Beyond the Vet Visit. Before we get started, I want to remind you that this video is intended for educational purposes only. Every pet is different, and the information discussed here should not be considered a diagnosis or a substitute for professional veterinary care. If your pet has been diagnosed with a heart murmur, is showing signs such as difficulty breathing, collapse, fainting, severe weakness, or sudden change in their ability to exercise, please contact your veterinarian for advice specific to your pet. The goal of this channel is to help you better understand veterinary medicine, so you can have more informed conversations with your veterinarian and feel more confident caring for your pet. So, let's start by talking about a common question I hear from pet owners during a routine examination. My dog has a heart murmur. What does that mean? And that's an excellent question because the answer is not always simple. A heart murmur is not a disease by itself. It's a sound that your veterinarian hears when listening to your pet's heart. That sound tells us that blood is moving through the heart differently than we expect, but it doesn't tell us exactly why it's happening or how serious the problem might be. In fact, heart murmurs are more common than many owners realize. Approximately one-third of dogs will develop a heart murmur at some point in time in their life. However, only a portion of those dogs will go on to develop significant heart disease or failure. This is why hearing the words heart murmur doesn't automatically mean your dog has a life-threatening heart condition. Some dogs have very mild murmurs that simply need to be monitored over time. Other dogs may have murmurs caused by underlying heart disease that require additional testing or treatment. The challenge is that we can't determine the importance of a heart murmur just by hearing it with a stethoscope. We have to look at the entire picture. That includes things like your dog's age, breed, physical exam findings, the characteristics of the murmur, and sometimes additional testing to understand what's actually happening inside the heart. In this episode, we're going to break down what a heart murmur is, how veterinarians grade murmurs, the most common causes of murmurs in dogs, and how we determine whether a murmur is something to simply monitor or something that requires further attention. We will also talk about when treatment is needed and why not every dog with a heart murmur needs treatment. Because the most important thing I want owners to understand is this: hearing the words heart murmur can be scary, but understanding what those words mean can help you make better decisions for your pet. So let's start by talking about what a heart murmur actually is. To understand a heart murmur, we first need to understand how the heart normally works. The heart is a pump. Its job is to move blood throughout the body so that organs and tissues receive the oxygen and nutrients they need. Inside the heart, there are four chambers and several valves that help direct blood flow in the correct direction. When everything's working normally, blood moves smoothly through the heart. But sometimes, blood doesn't flow as smoothly as it should. When blood flow becomes turbulent, it can create an abnormal sound that a veterinarian can hear with a stethoscope. That abnormal sound is called a heart murmur. A simple way to think about this is to imagine water flowing through a smooth stream. When the water moves smoothly, you may not really hear anything at all. But if that water flows over rocks or around obstacles, it becomes more turbulent and creates sound. The same basic idea applies to the heart. A heart murmur tells us that blood is moving differently than expected, but it doesn't tell us exactly why it's happening. And this is one of the most important things for pet owners to understand. A heart murmur is not a diagnosis by itself, it's a finding. It's a clue that tells your veterinarian that there might be something different happening with the blood flow through the heart. Sometimes that change is mild and doesn't significantly affect the heart's ability to function. Other times, a murmur can be caused by an underlying heart disease that requires additional testing, monitoring, or treatment. This is why veterinarians do not make decisions based only on hearing a murmur. The sound gives us information, but we need to put that information together with the other pieces of the puzzle, like your dog's age, breed, physical exam findings, and sometimes additional testing. Another important point is that a heart murmur does not automatically mean your dog has heart failure. Heart failure is a specific condition where the heart's no longer able to meet the body's needs effectively. Some dogs can have a heart murmur for years without ever developing heart failure. Others may have a murmur that's an early sign of a more significant problem. The goal is not simply to find the murmur. The goal is to understand what is causing it and determine what, if anything, needs to be done. And that brings us to the next important question. If veterinarians hear a heart murmur, how do they describe how significant it might be? Now that we understand what a heart murmur is, the next question many owners have is, my veterinarian told me my dog has a grade 3 heart murmur. What does that actually mean? When veterinarians talk about the grade of a heart murmur, we're describing the intensity or loudness of the sound that we hear through the stethoscope. Heart murmurs are typically graded on a scale from 1 to 6. A grade 1 murmur is very soft and can be difficult to hear, even for an experienced veterinarian. A grade 2 murmur is still relatively soft, but it's easier to detect, usually only on one side. A grade 3 murmur is considered a moderate murmur and is clearly audible when listening to the heart, and it's usually louder on one side than the other. A grade 4 murmur is even louder, and a grade 5 murmur is very loud and might be associated with something called a thrill, which is a vibration that can sometimes be felt through the chest wall. A grade 6 murmur is the loudest grade and can actually be heard even when the stethoscope is slightly lifted away from the chest. But there's an important point that I want every pet owner to understand. The grade of a heart murmur tells us how loud the murmur sounds. It doesn't tell us exactly how serious the underlying heart disease is. A louder murmur does not always mean a more severe heart problem, and a quieter murmur does not mean that there's nothing important happening. The reason is that the loudness of the murmur depends on several factors, including how much turbulent blood flow is occurring and where the turbulence is happening. For example, some conditions create very loud murmurs when the heart's still functioning normally. Other conditions might create quieter murmurs, but still require careful monitoring and evaluation. This is why veterinarians do not make decisions based only on the grade of the murmur. The grade is one piece of information. We also consider things like your dog's age, breed, symptoms, physical exam findings, and sometimes additional testing to understand what's actually happening. So when your veterinarian tells you your dog has a grade 2, 3, or 5 murmur, think of that number as a description, not a prediction of your dog's future. And that leads us to the next question. What actually causes the heart murmurs in dogs? So now that we understand what a heart murmur is and how veterinarians describe them, let's talk about what actually causes these abnormal sounds. The important thing to understand is that a heart murmur does not always mean there's a problem with the heart itself. A murmur simply tells us that blood is moving in a way that creates an abnormal sound. There are several different reasons this can happen. Sometimes a murmur occurs because blood flow is flowing faster than normal, even though the heart structure itself might actually be completely normal. This is sometimes called a flow murmur. For example, conditions that change how blood moves through the body, such as anemia or low blood volume, can sometimes create a murmur because the heart's moving a larger volume of blood more quickly. Other systemic diseases or changes in the body can also occasionally contribute to these types of murmurs. In these situations, the heart itself may not be the primary problem. However, many murmurs we diagnose in dogs are related to structural changes within the heart. This means there is an abnormality involving the heart valves, heart muscle, or the way the blood moves through the heart. So let's talk about some of the more common causes. The most common cause of acquired heart murmurs in dogs is degenerative valve disease, especially involving the mitral valve. This condition is most commonly seen in older small breed dogs, like some of my dogs, Cavalier King Charles Spaniels. Over time, the valve can become thickened and less able to completely close. When the valve does not seal properly, some blood can leak backwards instead of moving forwards normally. That backwards flow creates turbulence, which is what we hear as the murmur. It's important to understand that many dogs with valve disease can have a murmur for years before they ever develop signs of heart failure. The presence of a murmur tells us there is abnormal blood flow, but additional evaluation helps determine how significant the disease is. Another important cause of heart disease in dogs is dilated cardiomyopathy, often shortened to DCM. With DCM, heart muscles become weakened and the chambers of the heart become enlarged. Because the heart's not contracting normally, it may not pump blood as effectively. Some dogs with DCM can develop murmurs, although the findings can be different from those seen with valve disease. This condition is more common in certain breeds, and genetics can play an important role. We've also started to see some cases of DCM caused by diet. Some dogs are born with abnormalities in the structures of their heart. These are called congenital heart diseases. Examples include abnormal connections between blood vessels, defects between the chambers of the heart, or problems with heart valves that develop before birth. These conditions are often identified when dogs are very young, although the timing and severity can vary. Finally, it's important to mention that not every murmur is caused by disease. Some puppies can have what's called an innocent murmur. These murmurs are related to normal changes in blood flow as a young dog grows and develops, and many will resolve as the puppy matures. The reason veterinarians investigate murmurs is because we want to understand which situation we're dealing with. Is this simply a change in blood flow? Is there an underlying heart problem? Or is there another disease that's affecting the body that we need to know about? The murmur gives us a clue, but understanding the cause is what helps us determine what happens next. And that leads us to the next important question. How do veterinarians determine whether a heart murmur is something to monitor or something that requires further evaluation? Now that we understand what causes heart murmurs, the next question is probably the most important one. How do we know if a heart murmur is something we need to worry about? The answer is that veterinarians do not make decisions based on only hearing the murmur. The heart murmur is a clue. Our job is to figure out what is causing that sound and whether it's affecting the heart's ability to function normally. There are several pieces of information we use to put that puzzle together. The first piece is a physical examination. When your veterinarian listens to your dog's heart, they're not just asking, is there a murmur? They're evaluating many details about the murmur. Where is it heard? What does it sound like? When does it occur during the heartbeat? How loud is it? Is the heart rhythm normal? Are there changes in the pulses or other findings on the exam? All of these details help give us clues about what might be happening inside the heart. Another tool veterinarians use is a chest x-ray. Chest x-rays do not allow us to see the heart valves directly, but they can provide important information about the overall size and shape of the heart. They can also help us look for changes in the lungs, including signs that may suggest fluid buildup related to heart failure. We can also generally see fluid buildup in the abdomen as well. However, one of the most important tests for evaluating many heart murmurs is an echocardiogram. An echocardiogram is essentially an ultrasound of the heart. It allows us to actually see the heart beating and evaluate the structures inside the heart, including the valves, chambers, and heart muscles. It also allows us to evaluate how blood is moving through the heart. This is often the test that helps us answer the biggest questions. What's causing the murmur? How severe is the problem? Is the heart changing because of the disease? And does this pet need treatment? A helpful way to think about it is this. The stethoscope tells us that there's a sound. The echocardiogram helps us understand what that sound means. Depending on the situation, veterinarians may also recommend additional testing. This could include an ECG, which evaluates the electrical activity and rhythm of the heart. Blood pressure measurements may also provide useful information. In some cases, blood tests that might look for markers associated with heart stress could be helpful as part of the overall evaluation. Also, doing just routine blood work and looking for things like anemia could be helpful. The important thing to remember is that every dog is different. A young dog with a newly detected murmur may need a different approach than an older dog with a long-standing murmur. A small breed dog with a valve murmur may be evaluated differently than a large breed dog where we're concerned about heart muscle disease. The goal is not simply to find the murmur. The goal is to understand what is happening inside the heart so that we can make the best decision for that individual pet. And that leads us to one of the biggest questions owners have. If my dog has a heart murmur, when does treatment actually become necessary? Now that we understand how veterinarians evaluate heart murmurs, the next question many owners have is, since my dog has a heart murmur, do they need medication? And the answer is not always. One of the most important things to understand is that we do not treat the sound of the murmur itself. We treat the underlying condition that's causing the murmur. A dog can have a heart murmur and not need medication at that time. Some dogs may simply need regular monitoring to watch for changes over time. That monitoring might include routine physical exams, repeat imaging, or other testing depending on the individual pet and the type of heart disease that's suspected. The reason for this approach is that heart disease can change over time. A dog with a mild condition today may be very different from that same dog months or years later. Our goal is to identify important changes early and make treatment decisions when they are most likely to help. So, what determines whether treatment is needed? First, we look at the cause of the murmur. A murmur caused by degenerative valve disease is managed differently than a murmur caused by congenital heart defect or a heart muscle problem like dilated cardiomyopathy. Second, we look at whether the heart itself is changing. Sometimes the heart can compensate for a problem for a long period of time. Other times, changes such as enlargement of the heart or decreased function may tell us that intervention is needed. Third, we look at whether the pet's showing signs that the heart is actually struggling. This might include things like decreased ability to exercise, coughing, difficulty breathing, collapse, or other changes that suggest the heart is no longer meeting the body's needs effectively. When a dog does develop heart failure, treatment becomes focused on helping the heart function better, managing symptoms, and maintaining quality of life. But it's important to remember, having a heart murmur does not automatically mean your dog has heart failure. Having a heart murmur does not automatically mean your dog needs medication. The right treatment plan depends on understanding what is happening inside your individual pet's heart. This is why the evaluation process is so important. The goal is not just to find that murmur. The goal is to understand that that murmur means something and determine the best plan for your pet. And with that, let's summarize the most important things to remember about heart murmurs. So, let's bring everything together. If your veterinarian tells you that your dog has a heart murmur, the first thing I want you to remember is this. A heart murmur is an abnormal sound, but it's not a diagnosis by itself. That murmur may be caused by a lot of different things. Sometimes it may be mild findings that simply need to be monitored over time. Other times it might be a clue that there's underlying heart disease that requires additional evaluation or treatment. The grade of the murmur helps describe what your veterinarian hears, but it doesn't tell the entire story. To understand what the murmur actually means for your pet, veterinarians look at the whole picture. That includes your dog's age, breed, exam findings, symptoms, and sometimes additional testing such as blood work, chest x-rays, or echocardiogram. And one of the most important things to remember is that not every dog with a heart murmur needs medication. The goal is not to treat the sound of the murmur. The goal is to understand what is causing the murmur and determine the best plan for your pet. I know from both my experience as a veterinarian and as a pet owner that hearing the words heart murmur can be stressful, but having a better understanding of what those words mean can help you have a more informed conversation with your veterinarian and feel more confident making decisions for your pet. If your dog's been diagnosed with a heart murmur, your veterinarian can help you determine what the findings mean and what steps, if any, need to happen next. In later episodes, we'll follow up more with heart disease, heart failure, and the different types of heart conditions that we commonly see. If you enjoyed this episode, please like the episode and subscribe to our channel. If you've got a veterinary topic that you'd like to learn more about, leave it in the comments below. I'm Dr. Matt Clark. Thank you for joining me for another episode of Beyond the Vet Visit, and I'll see you next time.